Evelyne Ambwere, a renal nurse working at Moi Teaching and Referral Hospital. I'm here to present quality of life of osteomates at Moi Teaching and Referral Hospital on behalf of Mrs. Margaret Mungai. This is just a brief introduction about Moi Teaching and Referral Hospital. It is a 1,200 bed capacity level 6 hospital serving more than 25 million citizens from the Rift Valley and Western Kenya region, Uganda, South Sudan, and Lower DRC. Background information, you find that osteomy or colostomy, ileostomy, urostomy, surgery provides an artificial passage of stool and urine. Colostomy from the colon with well-formed output. Ileostomy from the ileum with semi-digested, semi-formed output depending on the site. While urostomy allows urine passage after bladder removal. Evidence indicates great need to maximize quality of life of osteomates, unlike curing associated symptoms. Nurses and midwives, we do play a great role in ostomy care, provision, in hospitals, community, though little documentation exists from the region. There is a lot that is happening in involvement of ostomy care, but there is little evidence that is being shared. So these are just figures illustrating different sites where we have osteomies being channeled. The aim of the study, you find that lack of adequate knowledge and experience in ostomy care amongst patients and clinicians at the hospital, compounded by social isolation and stigma faced by osteomates, led the team to undertake the research. So the researchers aimed to gain more insight by determining effects of osteomies on quality of life, focusing on the nutrition, adaptation, psychosocial effects, and sexuality aspects. The methodology, the study design was descriptive survey. The method used, we had interviewer-administered modified City of Hope quality of life of osteomates questionnaire, and we had 47 items on nutrition, psychosocial aspect, and sexuality. The sampling design was purposive sampling, where we had 81 participants who took part. That is after ethical and institutional approval. The study results, 54% were males, and majority were aged between 35 and 44 years, with colorectal carcinoma, intestinal obstruction, and traumatic injuries were leading indications for osteomy creation. You find that osteomates resumed sexual activity, though finding it unfulfilling, with a p-value of 0.002. Then most osteomates were depressed with suicidal attempts that negatively correlated with their quality of life. Actually, it's not a good thing. And putting into consideration majority were males, we all know what revolves around to do with sexuality. And most men get it the worst. The results, osteomates adjusted their diets regardless of their quality of life levels. Availability of ostomy care supplies was alleviated by patients having been enrolled in NHIF. Actually, NHIF does a lot, and we should become the sole campaigners for people to enroll with NHIF. NHIF does a lot. Treatment has become expensive. When we have our clients registered for NHIF, you find the burden goes a bit lower. In conclusion, osteomates experience a low quality of life with anxiety and depression, though a bit better with NHIF. OSTOMATE studied had a lower mean age, unlike in developed countries. Intestinal obstruction was the second leading indication for ostomy creation, unlike in developed countries. Recommendations. There is need to focus on prompt patient assessment and surgical intervention, prompt referral mechanism in view of intestinal obstruction being amongst leading indications to having an ostomy created, enhanced ostomy care training, and adopt integration of ostomy clinics in mainstreaming health service in public hospitals. Focused hospital and community ostomy health education, including NHIF enrollment. Since the research was carried out in MTRH, appreciation and acknowledgements goes to the Chief Executive Officer, Dr. Wilson Arwasa, who MBS for awarding the researchers 1 million from MTRH Hospital Intramural Fund to carry out the study. So you find that MTRH is very supportive. Thank you.